welcome. My name is Chris from ChristopherHole.com. Welcome to this whiteboard presentation where we're going to be talking about a great stretch for scoliosis. Now, there are many good stretches for scoliosis, but a lot of them will depend on where your scoliosis is and what muscles are weak, what muscles have tightened up. So then you would then sort of create those specific stretches for who you are. What we're going to look at is we're going to look at and review the muscles that we talked about before. If you watched my last whiteboard presentation, we talked about muscles involved in scoliosis. And then in the second slide, we're going to understand some key points when stretching. And that's from a more general perspective rather than specific perspective, because I don't know, obviously, who you are and what your scoliosis is. Before we get into that, I'll just mention my social channels. So we've got Twitter, Facebook and Instagram. On Twitter, it's @ChristopherHole. On Facebook, it's Christopher Hole Training. And on Instagram, it's Christopher Hole again. So please come along there, like, follow, ask any questions that you may have. That's what these videos are all about. It's answering people's questions. That's what Christopher Hole Training is all about. It's answering people's questions, giving them a better understanding of their health and fitness challenge so they can rebuild or build their fitness better than they've ever had it before. Alternatively, come to the website where you can go to ChristopherHole.com/join, put your name and your email address in, and join the free monthly newsletter, which again is all video content. We try to cover as much as we can around health and fitness, anything that fits under the umbrella really, which might be exercise, it might be diet and nutrition, it might be mindset, psychology, habits, anything like that that we can link to health and fitness, we try to cover, that we try to answer those questions. So bringing us back to today's presentation, quick review of the muscles involved in scoliosis. So when we looked at scoliosis, muscle imbalance and treatment from the British Journal of Sports Medicine, they said in the lumbar region, which are the first 5 vertebrae down here, so these bigger ones, they said the glute medius and the quadratus lumborum were weaker on the convex surface. So on the outward curve here would be glute medius, would be down here on the side of the hip, and then QL or quadratus lumborum in here would be weaker, and then the erector spinae multifidus, which both of the muscles kind of go all the way up the spine, but on the concave side, they are the weaker side. Obviously on the convex side, that would be the tighter side. So they're the ones that we would be stretching. So when we are talking about stretching, it's the opposing muscle to the one we're talking about here. So if your glute medius on the convex side is weaker, your glute medius on the concave side, as a general rule, might be tighter, if that makes sense. And the same with the QL, quadratus lumborum, erector spinae, and multifidus. Then when we come to the thoracic spine, we've got trapezius, serratus anterior, and rhomboid. Trapezius is the big muscle that goes from spine, out to the shoulder, up to the neck, and obviously down the other side as well. Serratus anterior is on the outside of the ribs here, and rhomboids go from scapula or shoulder blade into the spine, and then the one on the left side from the scapula out here onto the spine. So again, on the convex side, so the bulges outward side, that would be weaker. On the concave side, it would be the tighter side, so that would be the side that we would stretch. And then the same with the rhomboid. On the concave side, that one was weaker, and the convex side will then be its opposite, and generally the tighter side of those muscles. So that's just a quick review. When we come on to the stretch, a couple of things that we want to think about. First of all, we want to stretch the concave side. So if we just flick back, the concave side is bulges inward, or inward curve, if you will. So if we come back here, you've got this inward curve here. Now again, it depends on where your scoliosis is. Is it the same as this picture? Is it higher up? Is it lower down? So that's what you again would have to determine for yourself to make this stretch a little bit more in the way specific. But we want to stretch the concave surface. So what we want to do is this surface here, this concave curve, we would want to put that towel or a foam roller underneath the rib cage here, and then we would want to try and flatten that inward curve, if that makes sense. And then what we can do is we can look at the stretch, to stretch the shortened muscles of the hips and the shoulder. So when we were talking about the glute medius and the rhomboids and the trapezius, depending on which muscles are tight, they're the ones we want to stretch. So it's not necessarily following exactly what this video is saying, but this video should give you some insight into how to understand your body, so you can go away and then put the specific stretches together for yourself. So if we come on to this diagram here, which is the as best as I can do as a general stretch, you've got a towel, or could be a foam roller, or it could be anything that creates or lifts that midsection or that torso. What we've then got, you've got the hips on top of each other, and his top leg is forward with his knee on the floor. His bottom leg is straight. Now all that's there to do, that's just to keep the hips in position. So they'll be tilted forward slightly, that's fine. And that's what that bent leg is doing, just keeping those hips, keeping you from falling forwards or backwards, if that makes sense. And then we're just using this top arm over the head to create a little bit of leverage, so we can really try and sort of arch or flatten that concave arch out. And then the bottom hand is just tucked under the head, just to support the head. Or you could have a towel here, or again a foam roller, just to keep the head supported, if you will. So, or from a general perspective, this is the type of stretch that you'll be looking for. So it's trying to flatten out that concave surface. So that inward curve, we will want to be leaning this way over a roller, over a towel, to be able to try and straighten or flatten that inward curve of scoliosis. So hopefully that's giving you a little bit more of an insight into where your scoliosis is. Hopefully it's giving you an insight into the muscles that you might need to think of stretching. And hopefully it's given you, although we haven't talked about it, an idea of the muscles that you might need to activate and make a little bit stronger, if you will. So, many thanks for watching. My name is Chris. I will speak to you in the next video.